In this session, we will discuss medications that can be used to treat nociceptive pain, which is pain that arises from injury or disease to the body tissues, such as muscles, bones, and organs. There are 3 learning objectives. First, we will review the medications available to treat nociceptive pain and when one agent might offer benefits over another. Second, we will describe how dosing of opioids in older adults is approached differently than in younger adults. And finally, we will discuss how bowel care and addiction concerns can be addressed. Refer to LexiComp at the web address on the screen for more information about these medications. There are several options available for treating nociceptive pain. For mild to moderate pain, consider acetaminophen or NSAIDs, which are non-steroidal anti-inflammatory drugs. When pain is not controlled by these agents, consider adding opioids. Weaker opioids should be used for moderate pain, whereas strong opioids should be used for severe pain. In addition to these agents, adjuvants can be used if there's a component of neuropathic or nerve pain. Adjuvant medications will be explored in presentation number 10 and include medication classes such as antidepressants and anticonvulsants. In addition to the above options, which are primarily used orally, there are topical options available as NSAIDs, anesthetics, and capsaicin. Acetaminophen is useful for nociceptive or musculoskeletal type pain such as osteoarthritis and lower back pain, but is not effective for pain that arises from inflammation such as rheumatoid arthritis. There are short and long-acting formulations available, allowing you to tailor therapy to the individual. Some brands offer a 2-phase release where the first layer of the caplet provides quick relief and the second layer slowly releases, providing medicine over a longer period of time. This is a good option for nighttime or early morning pain. Acetaminophen can be found in combination with other analgesics. For example, Tylenol No. 3 contains both acetaminophen and codeine. However, due to the inclusion of acetaminophen in many products available both over the counter and by prescription, you must always be mindful of the total daily dose from all sources. Cough and cold products often contain high doses of acetaminophen. The maximum daily dose for acetaminophen depends on whether it is being used on an as-needed basis or if it is being used regularly. If acetaminophen is being used as needed, the maximum daily dose is 4 grams. However, if it is being used daily as a scheduled long-term treatment, the daily dose should be limited to 3.25 grams daily. These dosing limits differ due to the cumulative long-term effects of acetaminophen on the liver. In addition to the lower daily dose, chronic acetaminophen users should have liver function tests done regularly, particularly if other lifestyle factors such as high alcohol consumption are present. NSAIDs are used for the treatment of pain and inflammation. As you can see from this list, there are many medications that fall under this category. Some of the more common medications include ASA or aspirin, diclofenac, ibuprofen, naproxen, and celecoxib. There are risks associated with the use of NSAIDs in older adults, significantly limiting their use in this population. The potential side effects of NSAIDs need to be considered as the risks often outweigh the benefits. NSAIDs can worsen heart failure and increase the risk of serious cardiac events, including heart attacks. Some NSAIDs carry a lesser risk related to heart concerns than others. Naproxen, celecoxib, and ibuprofen appear to be risk neutral, whereas agents such as diclofenac and indomethacin have an increased risk. NSAIDs can also cause acute renal failure and should be avoided in individuals with significantly reduced renal function. Gastrointestinal effects can also occur with the use of NSAIDs, and these effects can range from an upset stomach to the more serious ulcers and GI bleeds. NSAIDs can also have effects on the central nervous system. For example, indomethacin, which is commonly used in the treatment of gout, can cause dizziness, vertigo, and confusion. Various opioids are available for the treatment of nociceptive pain. Some are considered to be of weak potency, such as codeine, and others are considered to be strong opioids, such as hydromorphone. Some opioids can be considered either weak or strong, depending on the formulation. Morphine is the measuring stick that opioid potency is measured against. As you can see in this table, meperidine and codeine are not as potent compared to hydromorphone or fentanyl. A morphine equivalence table is an important tool to use whenever switching between opioids. Equivalent doses must be calculated when switching, keeping in mind that tolerance to this class of medication can develop. Whenever using an opioid, always reassess the individual to ensure the medication is effective and if any short-term or delayed adverse events develop. Older adults often do not require the same doses of opioids as younger adults. Age-related changes, such as decreased kidney function, changes in liver metabolism, and body composition, generally result in increased and prolonged medication levels, resulting in a greater risk of side effects. As a result of these changes, older adults often require only half to 1/3 of a usual or recommended adult dose of an opioid. When initiating opioid treatment in an individual who is considered frail, start with a dose no more than 50% of what is usually recommended. Also consider reducing the dosing frequency. For example, go from 4 times daily to only twice daily. Remember, start low and go slow. It is important to remember that all opioids can cause constipation and that this side effect is not dose dependent. While individuals treated with opioids will likely develop tolerance to side effects such as nausea, this does not occur with constipation. Constipation may drive an individual to not take his or her opioid as prescribed or to stop taking it altogether. One treatment goal with opioid therapy should be to have a non-forced bowel movement at least every 3 days. However, this goal needs to be based on the individual's normal bowel movement pattern. A first-line treatment for opioid-induced constipation is a stimulant laxative such as Senokot. However, alternatives are available. Some individuals fear they will become addicted to opioids. It is important to be able to explain the difference between a psychological addiction and a physical dependence. They are not the same thing. It is normal to develop tolerance and dependence to medications such as opioids. Tolerance is a decrease in a medication's effects over time. For example, within a few days, people develop a tolerance to nausea and the sedative and cognitive effects of opioids. In the same way, over time, tolerance may develop to the pain-relieving effects, resulting in the need for an increased dose. If a medication is abruptly stopped, physical withdrawal effects can occur, such as sweating or anxiety. Addiction to pain medicine in older adults is extremely rare, particularly if there is no history of substance abuse. Pain medications can be misused in any population, but treatment of significant pain is appropriate and is not a misuse. Be mindful of the fear of addiction and the language you use to describe opioids so as not to contribute to this fear. To summarize, the recommended acetaminophen dose is dependent on whether the medication is being used chronically or only for a short time. 4 grams daily can be used intermittently, but the dose must be reduced to 3.25 grams daily if used regularly. NSAIDs pose many risks for older adults, and as such, their use is limited in this population. Opioids need to be used with caution in older adults, as the medication effects can be prolonged. Address bowel care and addiction concerns with every person taking opioids.